All right, so this is my presentation on my research project that I've been working on for the duration of this semester, and it just went over the use of cognitive behavioral therapy in reducing anxiety-related symptoms. So just to go over a brief description of this study. So the main research question that I put a lot of effort into exploring was, does the use of cognitive behavioral intervention reduce anxiety-related symptoms in a 29-year-old female client? So why is this relevant? So this is relevant because anxiety impacts a lot of the adult population. So according to the American Psychiatric Association, anxiety-related disorders impact approximately 30% of the adult population, which I think is pretty significant. So that makes this study, I think, pretty relevant for a lot of people. And so in terms of the variables for this study, the independent variable is cognitive behavioral therapy, and the dependent variable is anxiety-related symptoms. And I'll talk a little bit more about what that means later on in the presentation. I just need to move my box of people around to make sure I can see the slide. Okay. So looking at what the literature has to say about anxiety. So Sartori and Singwall describe or define anxiety as an emotional response to a potential future threat or danger, eliciting symptoms of negative, affective, somatic, behavioral, and cognitive components along a continuum based on intensity and duration. So this just kind of means it's a response our body uses to address a potential threat or sense of danger. And I thought this was interesting because anxiety is not inherently a negative thing. It was initially intended to increase our chances of survival. And so again, I think it's interesting to think about it as not necessarily a negative emotion or response, but it can become maladaptive. So when does it become maladaptive? It happens when symptoms impede on one's ability to function. So whether socially or whether it impacts your physical health or your vocational life. So this is when anxiety may potentially become a concern or an issue that one would want to address, is when it does kind of interfere with your ability to function in various regions of your life, such as those that I just specified. So looking at how anxiety has been portrayed throughout history, as I said before, anxiety has been around for a long time, as it was initially intended for survival, but it did only kind of recently become sort of known in psychiatric classifications in the 20th century. So, and over time, these disorders grew more and more specific as we learned more about the different symptoms and side effects and sources of the anxiety. So diagnoses such as PTSD, generalized anxiety disorder, and panic disorder didn't come until later. And so looking at what factors contribute to anxiety-related symptoms and disorders, there's a lot of environmental factors to consider. So Lobos Rivera talked about how COVID-19, the recent pandemic, impacted a lot of people with a lot of increased anxiety. They discussed a lot of increased anxiety-related behaviors such as compulsive purchasing, fear to social contact, and increased overall stress, anxiety, depression, and fear towards COVID-19. So again, looking at this environmental factor of, we're facing this relatively new pandemic, and there's a lot of response to that in terms of just the overall increased anxiety there. Another environmental factor to consider is just traumatic events. As I said before, anxiety was initially intended for survival, and trauma by definition is something that you have either witnessed or have been exposed to that is potentially harmful or life-threatening to you. And so there can be a lot of associations between anxiety symptoms and just exposure to those traumatic events. And so looking at the current interventions that a lot of research has supported, there's been a lot of studies done on exposure therapy. So evidence has supported that symptom reduction could be due to inhibitory learning or the creation of new safety associations that compete with and eventually override learned fear associations. And so this basically just kind of means that you're able to sort of face the stimulus or the object that may be triggering some of that anxiety and associate it with new feelings or learned associations of, okay, this thing may not have to be anxiety provoking. This thing may not have to be, as high stakes as it feels at this moment. And then lastly, cognitive behavioral therapy. So there is a lot of research on different CBT treatments. So exposure therapy is actually a form of behavioral therapy. So, but general CBT treatments, there's a lot of evidence for that effectiveness in reducing symptoms, and was also called the gold standard for treatment for treating anxiety disorders by Hans and Hiller. And so there's definitely a lot of research founded in the CBT treatments. And so looking at the methodology of my study that I did, it was an A/B single subject design, meaning there was a baseline phase and an intervention phase. The baseline phase lasted 3 weeks, intervention phase lasted 4 weeks. So it was a total of 7-week study. And the data was collected consistently throughout the full time of the study. So both in the baseline and intervention phase. We used the GAD-7 and the daily self-rating scale, again, for the whole duration of the study to collect the data and just track the client's symptoms. And again, the independent variable, so the thing we're using to change the dependent variable is CBT, and the dependent variable, meaning the thing we are looking to change, is anxiety-related symptoms. And so a little bit more about the study participant. So the participant was a 29-year-old Caucasian female. She currently resides in Denver, Colorado, and can also be described as married, heterosexual, middle class, and is employed full-time. And she discussed a lot of symptoms associated with anxiety. She does not have an official qualifying diagnosis of anxiety, but she did describe a lot of those symptoms, such as feeling nervous and on edge a lot of the times, having difficulty controlling her worrying, just feeling like she's worrying all the time. And the biggest one that she has articulated having difficulties with is just having challenges with relaxing and slowing down and being able to feel calm and relaxed. And so something that is particularly interesting to know is just that these symptoms have had a significant impact on her ability to function in various settings, such as social settings. She's described a lot of difficulty with remaining present with people and being able to enjoy being around with friends, being able to, kind of keep her mind in the present and not on things that she does say that she worries about quite frequently. And it also impacts her professional life in an interesting way, as she actually works quite a bit more to kind of cope with these symptoms. And so it does have an effect and impact on her ability to function in the professional realm, but actually, again, kind of drives her to work a little harder, which she has specified may not necessarily be healthy for her specifically. And so some ethical considerations for this study: this client actually has a personal relationship with the researcher. So myself, I'm actually very close friends with this person. So I think that is very, very important to note for this study, as that could impact the efficacy and the integrity of the study. This could influence the client's responses to the surveys. She may, want to either inflate her scores or lower her scores throughout the study to make it look successful on my behalf. And so that's just something to keep in mind as we kind of go through the outcomes of the study, and again, could impact the efficacy of the study. And so talking a little bit more about the intervention that I used, as I said before, I used cognitive behavioral therapy to hopefully reduce, in an attempt to reduce the anxiety related symptoms. And Corey talks a lot about kind of the foundation of CBT, and that it explores the relationship between cognitive and behavioral patterns and emotional outcomes. So basically how you think impacts how you act, which impacts how you feel. So there's obviously a cyclical relationship between these two aspects of one's being, or at least that's what CBT argues or kind of theorizes. And so it also argues that the root causes of symptoms often relate to one's cognitive processes. So again, how you think impacts how you feel and how you act. And so it also typically involves a lot of homework that hopefully targets a lot of these behavioral and cognitive patterns and processes, and emphasizes a lot of psychoeducation. So, my hope in using this would be that the more this client understands that there is a connection between thought patterns and behavioral patterns and emotions, the more she can feel empowered to potentially change those thought processes to hopefully reduce those feelings of overall anxiety. So to kind of help her give back control to those symptoms and reduce those symptoms. And so this slide includes just 2 examples of worksheets that we went over. So the first one from psychpoint.com just kind of goes over some basic CBT tools. It discusses a lot of different examples of cognitive distortion. So kind of how our brain could potentially there's a couple of different examples of overgeneralization, catastrophizing, which is one that this particular client related to a lot. So expecting the worst to happen. For this client specifically, her husband is a firefighter. So being fearful that her husband is going to be injured at work was often one of the main worries that she wanted to focus on. And so there was a lot of, again, just expectations that the worst was going to happen when her husband was at work. And so we were able to kind of target this specific thought pattern that she was dealing with a lot that was increasing her overall levels of anxiety. And so the second worksheet kind of on the right here of this slide is just a tool that lists different prompts to help you decatastrophize. I'm not exactly sure if that's a word, but that is what this kind of worksheet says at the top. And so this worksheet is from Therapist Aid. And again, it just kind of lists the different prompts you can use to hopefully alleviate some of the worries. So first question is, what are you worried about? So an example given by this client would be that my husband gets injured at work. And the second question was really key for her. So how likely is that worry to come true? Pretty much, I'm not sure that it's ever happened that her husband has come home from work with a serious injury that resulted from work. And so she was able to use this as evidence against the worry that she had to help reduce those worries and say, okay, he is most likely to come home unharmed, given that he's come home unharmed frequently in the past. And so this was a really helpful tool for her to use. And so just looking at the kind of visual sort of outcomes of this study, this is a chart or graph that kind of displays the progression of her GAD-7 scores. So the overall anxiety symptoms that we measured over time throughout the full duration of the study. So the blue line you can see indicates the baseline phase. The orange line indicates the intervention phase. So there is an overall 60% decrease in symptoms between the first week and last week. First week she scored at a 9, and the last week she scored at a 4. And so it's a pretty significant change, I think. But again, this is just kind of what we were able to track and see throughout the duration of the study together. And so the next graph just looks at the specific daily self-rating scale that we used. So we targeted her specific symptom of having difficulty relaxing, and she rated her this difficulty on a scale of 1 to 10, 10 being the worst, 0 being that she has no difficulty. So again, as you can see, kind of the trend, it decreases a bit. And just looking at the average score during the baseline phase was a 7.01. The average score during the intervention phase was a 5.71. So just given those numbers, you can see that there is a slight decrease in this particular symptom. And so just looking at the discussions and limitations of this study, the clinical significance, so did the client find this helpful? She expressed that she did experience a decrease in symptoms, though she did not articulate that this was directly due to the intervention. So we don't necessarily know if the decrease was because of the intervention that we used. And also considering some external variables that may have impacted the scores. aside from what I had specified before, that she's a close friend of mine, which again is just an ethical consideration, but also something to consider in terms of the limitations of this study. The client also had her car stolen during the baseline phase, which likely inflated her anxiety scores, as it was a pretty significant stressor that does not happen in her everyday life. And this issue was resolved later on. So a lot of her scores were decreased. And this could be the result of having the issues with her car kind of resolved at that point. And other limitations to consider is that it is a single case design. And so it really is just focused on one specific client. And so it's really hard to be able to apply this to a larger demographic, just because it is a very specific scenario that is would be hard to replicate anywhere else. As well as there is no follow-up phase. So we really don't know what the lasting effects of this intervention would be, as it is a very brief study that does not provide any sort of data after the intervention concluded. And so these are just my references for the slides so far. And that is all I have. Thank you for watching.